Australia has one of the highest rates of prescribing of antidepressants in the world. We know that 1 in 4 older Australians over the age of 65 are taking an antidepressant, and 1 in 7 in the adult population. And I think that if you are going to go on to an antidepressant for the first time, then it's usually the guideline that you stabilise. Then after you've stabilised for 6 to 12 months, you then consider cessation, coming off it. A lot of people are staying on them for 4 or more years, which well and truly exceeds what we understand to be the guidelines.
On and off, I've been on antidepressants for 30 years. The most recent period of time I was on antidepressants for 10 years.
I've been on antidepressants for about 8 years.
I had been on antidepressants for about 7 years.
I was on antidepressants for about 20 years, on and off.
We know that depression in older people is really complicated. There is a myth out there that endures that depression is simply a chemical imbalance in the brain. That is a myth that needs to be put to bed. We know that depression is not that simple. It's not just a simple chemical imbalance. There can be all sorts of influences. Are you living with chronic pain, a chronic condition? Have you endured loss? Are you experiencing intense loneliness or social isolation? What sort of trauma have you been exposed to? Are you financially okay? So there are all sorts of factors that play into our experience of mood.
I first went on to antidepressants when I experienced a situation at work that ended up in me going off on what they called stress leave. I was referred to a psychiatrist by my GP. There was a change in my home situation, and then following that there was a breakup of a relationship. But then this last 10 years I've been feeling like I was stuck. I was too scared to come off them.
I was caring for my husband, who passed away with frontotemporal dementia. My doctor ran me through the standard test, which is depression, anxiety and stress, and it showed that I was showing signs of depression. She felt that it would be beneficial to go on a course of antidepressants.
I was subject to bullying in my workplace, and ended up being put on antidepressants. So my mental state was very poor. I was in a bad way.
I began antidepressants because my life situation had changed, and I became my father's carer while I was working full-time. My mood could be described as being upset easily, so crying and feeling not so great. The GP prescribed antidepressants initially for me.
The longer it goes on, and the partner becomes depressed themselves, and you ended up as the patient in a downward spiral. My wife, she suffered from my depression. She had symptoms herself. Our marriage became very fragile, and I didn't know how much longer it was going to last.
Your GP is not a bad place to start with that conversation around how you're feeling. And your GP can certainly do some assessments which helps gauge whether you have depression or whether you're experiencing emotional distress from other life events that may be happening for you. I'd encourage you to go to your GP and make a longer consultation. The other tip is to write down your questions and write down your answers. And if you can't read or write, which is the case for many people, especially if English is their second language, take someone with you, ask if you can record part of the consultation, and get resources that are actually appropriate to you in your own language or trusted websites.
There was no talk about a timeline. I wasn't told anything from memory about side effects. I just went with what the doctor suggested.
The doctor didn't discuss anything to do with risks associated with length of treatment with the medication.
We didn't discuss any potential problems of staying on the medication for too long. It was an impression that I had was that I was going to be on them for the rest of my life.
When I went on them, I didn't know how long I had to stay on them or what the future held.
Antidepressants won't be effective for everyone. I think that the guidelines are pretty clear, although they're not specifically about older people, that in mild to moderate depression, usually medications are not recommended and other therapies are talk therapy, lifestyle interventions and social connection. If you are to use an antidepressant, it's only fair that as a consumer that you understand, well, what's in this bargain? What am I getting for that? Okay, these are chances of it helping, and what are the chances of me having side effects like the increased risk of falls or fractures or something serious happening in terms of an outcome? And if I need to stop, what is that going to look like?